Hey guys, it's Gabby. I know it's been a while. I'm finally here to tell you about the ECE, or my experience in the clinical rotations to finally finish my PAVE process. In this video, I'm going to talk about my experience and my recommendations for you during this year for you to have a successful year. So first, let's talk about what your responsibilities and roles are during the clinical rotations. So during the clinical rotations, you will be working along with 4-year vet students, or in some cases 4th and 3rd year vet students, and you all will have the same responsibilities. They will probably include like a list of competencies or abilities that you may have to perform throughout the year. Some of them may be very technical, just like placing catheters or administering medications. They will also include probably the interpretation of certain diagnostic tests, or the observation or participation in certain procedures, or the discussion of topics that are relevant to different topics relevant for different services. So during this year, you will be part of different rotations in small animal medicine and in large animal medicine. There are some core rotations, which are the rotations that are obligatory for every person, regardless of the path that they decide to take during their vet school. They may include like things like small animal internal medicine, large animal internal medicine, things like anesthesia or diagnostic services or surgery, etc. You will also be part of some elective rotations, and you can tailor this to your needs or what your interests are for the future as a veterinarian. So during some rotations, you will be participating, like in some rotations are schedule based and you will have appointments. Your roles start not only during the appointment day, but also before this. Usually you will know ahead of time what cases you're working on. So reading medical records or the information of your patients is very, very important. During the appointment day, you will be the first person to take history on this patient and the first person who performs a physical examination. After this, you will discuss the case with your clinician. You will present the case to your clinician, and they will evaluate you in how easy it is for you to synthesize this information to create a problem list, come up with a differential diagnosis, and further in the case, you will probably participate in the diagnostic plan and the treatment plan. Additionally, some of the services also have inpatient care. For example, internal medicine, neurology, cardiology. Depending on the case, you will have patients that are hospitalized, and I'm not sure if in different universities they have different expectations, but I know that during the day you will participate with some of the treatments. They can be in specific hours. You will also perform like the first inpatient soap and physical exam. You will update your clinician on how the patient is doing, and this also means both for inpatients or for outpatients, you will have to keep up with the medical records and start discharges. This is also a great way to learn because they can evaluate your understanding of the case with the information that you're putting on the soaps or the information that you're providing to your client in the discharges. I also feel that this is a great way to practice real life situations, and I know that you will get better with time and with practice. There are services that do not have the schedule-based things like radiology, or they may have it, but you don't necessarily have to participate in an appointment. These services will probably evaluate you in different ways. You will learn how to interpret different things. Ultrasonography and radiology are like things that can be complicated, and you don't necessarily have to learn in a specialty level, but you have to get comfortable with certain things. You will probably also participate in the performing of these diagnostics. There are also services like anesthesia, where you also don't have appointments, and these ones, they will evaluate your comfort level with different protocols or patients that have different anesthetic risks or different comorbidities. You will both participate with both anesthetist and anesthesiologist, and there's definitely a lot of learning during this type of rotations. There are other rotations like emergency where you cannot predict exactly what's coming through the door, but these rotations are great for experience or learning, so definitely take advantage of those. There are other things that you will participate on as a student, like patient rounds or teaching rounds. Patient rounds will happen at different times of the day for different services. These rounds are the ones that clinicians present the cases. They will summarize the information. The specialists of the services will be there, and they will provide information or ideas for different patients. There will be services or clinicians that want you to learn how to present the case, and they will help you become more efficient, so you present or you focus in the most relevant aspects of the patient. And this is also like a real life situation, because when you become a veterinarian, this is what you're going to be doing later on, so I think it's helpful. You also have teaching rounds, and actually it was one of my favorite aspects in certain rotations, because you learn so much. Clinicians are great in giving like this kind of classes or sharing certain topics. Same thing for residents or interns. They help you understand certain topics a little bit better. This is a time for you to shine. You want to ask questions and you want to answer as many questions, because they will be asking a lot of questions for sure. And I think that one of the ways that they usually evaluate the students on is participation. So this is definitely a time to do that. Tips that I can give you, generally speaking, one of them is make sure that you're responsible. I feel that failing this year is really hard. I don't think I've heard of anyone failing this year, or like failing the evaluated clinical experience. If someone does that, that means that that person was not responsible at all. Because I feel that regardless of the case, or regardless of the rotation or the hours, you have to go with the proper mentality. The financial investment is quite high, so I don't think that anyone wants to go to this and do this just to waste time. It is not necessarily difficult, but it can be overwhelming at the very beginning, because you're learning and you're trying to do things as people do here in the United States. It may be a little bit different than in other countries, at least it was for me. And I feel that sometimes the hours can be difficult, that's for sure. Some rotations will have very long hours in hospital, and you can be exhausted in sometimes, but you will also have downtime. So I don't think this year is like tremendously horrible or difficult or anything in particular. If anything, despite how exhausted I was sometimes and how overwhelming certain things can be, I felt that this year was amazing. Was truly rewarding. There was, as I mentioned, I learned so much, and I feel that if you go with a proper mentality and you maintain that enthusiasm and willingness to participate, learn, and bring the best of you, I think you will do good. Everyone is capable, everyone can do it. I know that right now it's a little bit difficult for like many people to get in. I know there's a lot of people trying to apply at the same time. But remember, you can always try again. So I wish you luck. If you're trying to apply at this moment, you're waiting for results or anything, I really wish you luck. If you have any questions that I haven't been able to answer with this video, or you want to know more specifics about the clinical year, please leave them in the comments. One of the questions that I was asked recently is like, how can you guarantee that you will get a spot in the clinical year? And I truly don't think I can answer that question in particular. I think that everyone has different backgrounds or levels of expertise or levels of knowledge. As I mentioned, the most important goal for you is to bring the proper mentality and to be ready to learn. I know that many people come to this country with a lot of knowledge and they have a lot of experience, but things can be different. You may be seeing different diseases. Some things may be more or less common than in your country. Things may be done in a little bit different way. One of the advantages of doing this, with a lot of specialists and people who are like doing their internship or residency, is the fact that you will be surrounded by the best access to care, like in terms of technology or you will see a lot. So I feel that if you're enthusiastic and you're really willing to do well, I feel that you will. So the best of luck. Leave me some questions if you have, and I hope that this was helpful for you.